Today I want to talk to you about the talent needed to launch and manage an accountable care organization. This is a very challenging area that I suspect few organizations have had current experience with. There are several different strategies to how to populate the leadership in a startup company. I am convinced that a number of large healthcare systems have assigned some of their best and brightest people to be the developers of their accountable care strategies. If you're a national healthcare system, you have resources that can be applied in this way. But in fact, there are a lot of market considerations that need to be worked out. And if you're even thinking about becoming a demonstration site in 2012 for the 3-year demonstration project, you have a lot of work ahead of you in the year 2011 to get an accountable care organization up, much less develop a whole strategy for the rest of your system. So I think taking best and brightest is always a good strategy. It's one that large organizations can follow. If you're a smaller system or a standalone organization, you have a very different pool of talent to choose from. And I think this is where a little more invention takes place. You need to judge very quickly whether you have the right kind of talent to do a business startup, and whether that talent, in fact, is capable of running the new beast you bring up is a second decision that can be made and judged as they do the work in creating the startup. Quite often, startups have different teams from those who manage later on. So again, this is a reasonable strategy to consider. If you're a very small organization, say 200 beds and under, committed to have your own accountable care organization, you know my opinion on this, which is it may be smarter to assess this and find a larger organization with the slack resources to invest in the infrastructure and make a deal with them to be part of their ACO at attractive guarantees to your own organization. After all, owning the infrastructure is going to be a huge cash trap for a number of years. Without a return, it's going to be very, very difficult to see every organization that says they want to have an accountable care organization in a position to put those resources on the table. So in that case, you will be looking for the talent in another organization you might have confidence in. So let's talk about the kind of skill sets that are needed that you should be looking for. First of all, there are relatively few people in hospital management that have done pure, large-scale economic startups. Sure, people have started programs here and there. Sure, people have built facilities. But we're talking about something that's going to handle tens, if not hundreds of millions of dollars. We're talking about an infrastructure that requires massive new investment in computer linkages between all those electronic medical records that don't talk to each other. And we're talking about putting in place the kind of electronic, online performance databases that will help physicians manage quality and cost for their patient load. This is a very different kind of activity than most hospital administrators and those trained for that have engaged in. Now, first thought among some is that true communication experts, true CIOs from the private sector may be a way to go because of the infrastructure requirements. I can see some organizations going that direction. These are very large startup projects. People who have that experience can bring it to the table. And you can acquire, or you have, the healthcare experience that you need to add to their ability to marshal resources. Another way to go, because of the requirements for physician participation, is really to put a chief medical officer type in charge, someone that medical staffs have tremendous respect for and who is articulate and knowledgeable about the issues in managing care. He and she, in turn, can acquire the CIO type skills in terms of recruiting individuals for that position. This is also somewhat risky because most physicians haven't had the experience of running organizations with tens or hundreds of millions of dollars at stake, nor in managing large numbers of non-physicians. So it will take some really special physicians to go this route. I suspect we'll see it. In many cases, these may be more titular kind of hirings that satisfy medical staff needs and politics more than true startup management. Then there are those who have great skills in the planning, marketing side that are strategic in their focus, that will help develop profiles of the kind of products, geography, and providers that are needed to make the ACO reasonably successful from a business standpoint. This is probably, in my opinion, the most beneficial way to start, but it is not the most likely one to get support from organizations. And finally, there will be those who are young, up-and-coming hospital administrator types, very energetic. The organization is betting that they will mature, and the organization can spare them. These people represent a traditionally prepared senior management type individual that is capable, has the bandwidth to take on a very, very large project. Having mentioned those four types, CIO, Chief Medical Officer, Chief Strategy type, or hospital administrator, young hospital administrator, I think that represents the minimum tool set of individuals needed to plan the startup. Not that this is all that you need to run the organization, but it will take some serious work to make this organization successful. I think that there's no one place you can go to get this set of talents, and I think it's going to be very much a buyer's market for a while until there's a shakeout of whose performance and which style of performance is most successful. But we have plenty of time, and people have the money to put into this to find out which ways seem to work best. I say good luck to everybody because the nation needs our help and our leadership and, frankly, our success.